So do we have new indication for the management of patients with heart failure?
We just published new guidelines for the diagnosis and treatment of heart failure in May 2016 at our Heart Failure Congress in Florence. So we have to realize that there are now 8 life-saving therapies available for patients with heart failure. Just 3 decades ago, we had none. Now we have a lot of drugs and devices. ACE inhibitors, beta blockers, MRAs, which are mineral corticoid receptor antagonists. Just recently, the new drug, the ARNIs, the angiotensin receptor neprilysin inhibitors, is combined drugs, LCZ, have been introduced. They are life-saving as well. They have been placed in our new guidelines. On top of that, we have devices. Heart failure is now not only a drug, it's also a device therapy with ICDs and CRTs, both of which are life-saving. On top of that, we have VADs and transplants. So if you count them, we have 8 life-saving therapies for heart failure available. And with that, dramatically reduced the mortality in this deadly disease.
And in your opinion, do we need new drugs for these patients?
The recent results of huge trials showing survival benefit notwithstanding, the mortality still remains high. So there's an obvious need. We have not cured heart failure yet. We have reduced the mortality. We have reduced the morbidity that comes with it and the symptom relief, but there's still much to do. So we are developing new drugs, particularly in the field for patients with preserved ejection fraction, which is a stiff ventricle. Basically, we have nothing yet that has been shown to reduce mortality. We have to develop new therapies for acute heart failure, which is still what I call the Bermuda Triangle of trials, because whatever we tried there didn't really work. But hold your breath, there are 2 new trials coming in the next couple of weeks, and you will learn from that. And there's a field of advanced heart failure, patients who are sliding on inotropes, for whom we need ECMOs or mechanical circulatory support, and there's still much to do.